Very interesting. And you mentioned the tailoring it to the patient, which brings me to the very large question. So most of these questions came from Reddit and our Facebook group. And, most people want to know, bleomycin is a chemotherapy used in the treatment of testicular cancer very commonly, but it can have its effects on anesthesia. So are you able to kind of explain the lung toxicity from bleomycin and how that impacts anesthesia?
Yeah, absolutely. So it's something we study actually as far back as medical school. We go through a lot of the chemotherapeutic agents and the effects that they can have on the lungs and on the heart and on the nerves. So bleomycin-induced pulmonary toxicity is a thing that we're very much aware of. And a lot of it depends on, this is lung damage caused by the chemotherapeutic. It causes fibrosis. It causes your lungs to not work as well. The alveoli or air sacs that exchange the oxygen aren't able to do their jobs. So you may feel short of breath. You may feel winded. Sometimes this improves over time. And it's something that we're very much aware of when it comes to anesthesia. We understand the risk involved. Worst case scenario, this is an acute situation, which is going to last anywhere from 2 to 6 hours, depending on your surgery. And our job as anesthesiologists is to get you safely through that surgery. If you are a high-risk candidate coming into surgery, that should be figured out along the way in clinic or in your preoperative evaluation. This would be somebody that comes to the preoperative holding area. We get you hooked up to monitors and we realize that, your oxygen levels are actually very low on room air. That's a poor sign. It's a poor place to start from. And we'd probably hey, let's figure this out, make sure you're optimized for surgery. Can we fix the lungs up anymore? What's usually the case is patients that have bleomycin, they instead of sitting at an oxygen saturation of 100% on room air, maybe they're sitting at 95, 96, or maybe they require 1 or 2 liters of oxygen. But we know we need to do this surgery. So what do? We have to accept some risk with the oxygen. When we're walking around, we're breathing 20% oxygen. That's the fraction of oxygen in the atmosphere, right? 80%-ish nitrogen, 20% oxygen. In the operating room, we have the ability to deliver 100% oxygen. And we do, and we will likely do this as we're getting you off to sleep. When you're on the table, we're going to probably give you 100% oxygen because we want your lungs filled with oxygen. This allows you to be apneic. When we give you that medication and it stops you from breathing, you can be apneic for now 3 to 5 minutes. This is a safety margin. This allows us some time to safely place this breathing device into your lungs. Once that breathing device is in and we know it's in the right spot, we can then focus on titrating that oxygen down to the lowest FiO2 or fraction of inhaled oxygen that you can tolerate. This means, titrating down until your oxygen saturation's in the 92, maybe 94% range. And we'll try our best to keep it as low as possible. However, if you need more oxygen during surgery to survive, we will give you oxygen to survive. And what this means after surgery, depending on the level of lung damage, you may require some additional time to kind of wean yourself off of oxygen. This may determine whether you can go home immediately after surgery or if you need to stay in the hospital for observation. Maybe you wake up and you're requiring 2 or 3 liters of oxygen via nasal cannula, and it may take a little bit of time for you to recover. Most patients typically do. And I think they've gotten a little better with the dosing of bleomycin and kind of our tailoring our anesthetics to where this hasn't been too much of a problem. I know a lot of patients, I've had patients come in and say, I'm allergic to oxygen. And it's like, whoa, not quite. What you mean to say is, you have bleomycin-induced pulmonary fibrosis. We understand. We're going to try to limit the concentration of oxygen that we provide. But in the grand scheme of things, if you're not breathing, you've got bigger problems. So we want to make sure you get enough oxygen.